What are the critical components to consider when collecting a comprehensive health history from a patient, and why are these components essential for advanced diagnostic reasoning? Answer: when collecting a comprehensive health history, critical components include patient identification and demographics, name, age, sex, race, ethnicity, and occupation, as these factors can influence health risks. Chief complaint: the primary reason the patient is seeking care, which guides the focus of the assessment. History of present illness, (HEI), detailed chronological description of the symptoms, including onset, duration, and progression, which is crucial for differential diagnosis. Past medical history, previous illnesses, surgeries, and hospitalizations help identify potential comorbidities, medications, and allergies. Understanding current medications, including OTC and herbal, and allergies, is vital to avoid adverse reactions. Family history, genetic predispositions to certain diseases can inform the assessment. Social history, lifestyle factors such as smoking, alcohol use, and sexual history provide insight into risk factors. Review of systems, ROSE, systematic inquiry into symptoms across body systems aids in identifying issues that may not have been reported initially. Discuss the importance of cultural, social, and familial factors in patient history and how they impact health outcomes. Answer: cultural, social, and familial factors play a significant role in shaping a patient's health beliefs, behaviors, and access to healthcare. Key considerations include cultural competence. Understanding cultural practices and beliefs ensures respectful communication and encourages patient participation in care decisions. Social determinants of health, ESTO. Factors such as income, education, and environment can influence health access and outcomes. For example, patients in low-income areas may have limited access to nutritious food or healthcare services. Familial health patterns. Knowledge of family medical history aids in recognizing inherited health risks, which is crucial for preventive health measures. Recognizing these factors can lead to more effective care strategies tailored to individual patient needs and improved health outcomes. Clinicians should incorporate tools like the cultural formulation interview from the DSM-5 to systematically assess these dimensions. Mr. Adams, a 60-year-old man, presents with symptoms of persistent cough, fatigue, and weight loss. He has a 40-pack-year smoking history. What steps should Mr. Adams take next in seeking a diagnosis, and what are the potential differential diagnoses? Answer: Mr. Adams should consider the following steps. Schedule an appointment with a healthcare provider. He should seek evaluation from an advanced practice nurse or physician for a thorough assessment. Undergo a comprehensive health assessment. This includes a detailed history and physical examination focusing on respiratory symptoms. Diagnostic testing. The healthcare provider may recommend the following tests: chest X-ray to evaluate lung structure and identify any masses or infections. CT scan of the chest for a more detailed view if abnormalities are detected. Pulmonary function test, PFTS, to assess lung function. Sputum analysis to check for signs of infection or malignancy. Potential differential diagnoses: chronic obstructive pulmonary disease, COPD, given his smoking history. Lung cancer, considering the persistent cough and weight loss. Tuberculosis, especially if there is a history of exposure or risk factors. Pneumonia, if symptoms suggest an acute infection. How do advanced physical assessment techniques enhance the diagnostic process in clinical practice? Answer: advanced physical assessment techniques enhance the diagnostic process by improving diagnostic accuracy. Utilizing techniques such as auscultation, percussion, and palpation allows clinicians to gather detailed information about organ systems. Incorporating technology. Tools like ultrasound and digital stethoscopes can provide real-time imaging and sound analysis, facilitating more precise assessments. Holistic patient evaluation. Advanced techniques enable a comprehensive evaluation of multiple systems, improving the ability to identify complex cases with multiple comorbidities. Facilitating patient engagement. Involving patients in the assessment process through demonstrations of techniques can enhance understanding and cooperation. By integrating these advanced techniques, practitioners can develop a more accurate and nuanced understanding of the patient's health status, leading to better informed clinical decisions. Explain the significance of laboratory and diagnostic interpretation in advanced practice nursing and what key factors must be considered when interpreting laboratory results. Answer: laboratory and diagnostic interpretation is crucial in advanced practice nursing for several reasons. Guiding clinical decisions, accurate interpretation of lab results helps to inform diagnosis, monitor disease progression, and evaluate treatment efficacy. Understanding reference ranges, clinicians must consider that reference ranges can vary based on population factors, age, sex, ethnicity, and should be contextualized within each patient's clinical picture, identifying critical values. Recognizing values that fall outside normal ranges that require immediate intervention is vital for patient safety. Key factors to consider include clinical context. Results should be interpreted in conjunction with the patient's history, symptoms, and physical exam findings. Biological variability. Factors such as circadian rhythms, fasting status, and medication effects can influence lab results. Test reliability and validity. Understanding the sensitivity and specificity of tests helps clinicians assess the likelihood of true positives and negatives. Discuss the application of clinical algorithms and decision trees in advanced diagnostic reasoning. Answer: clinical algorithms and decision trees are valuable tools in advanced diagnostic reasoning because they standardize clinical decision-making. These tools provide a structured approach to evaluating symptoms and determining possible diagnoses based on established guidelines. Enhance diagnostic accuracy. By systematically narrowing down potential diagnoses, practitioners can avoid missing critical conditions. Improve efficiency. Algorithms streamline the diagnostic process, saving time and resources by guiding practitioners through complex clinical scenarios. Support evidence-based practice. Many algorithms are based on the latest research and clinical guidelines, promoting adherence to best practices. For instance, the National Institute for Health and Care Excellence (NICE) guidelines provide algorithms for managing common conditions such as hypertension or diabetes, outlining steps for diagnosis, treatment, and follow-up. MS. Smith, a 45-year-old woman with a family history of breast cancer, presents with a new breast lump. What diagnostic steps should be taken and what considerations should be made regarding her family history? Answer: MS. Smith should undergo the following diagnostic steps. Comprehensive assessment. Begin with a detailed health history and physical examination to evaluate the breast lump's characteristics. Imaging studies, mammography. To screen for breast cancer and evaluate the lump, ultrasound. To assess the nature of the lump, solid versus cystic, biopsy. If imaging suggests malignancy, a biopsy, fine needle aspiration, or core needle biopsy should be performed to obtain tissue for histological analysis. Genetic testing. Given her family history of breast cancer (MS), Smith should be counseled about genetic testing of ERA mutations, as this information could significantly impact her treatment options and preventive strategies. Considerations. Family history is a critical factor in assessing breast cancer risk, necessitating enhanced screening protocols and potential prophylactic measures. The American Society of Clinical Oncology (ASCO) recommends that women with a strong family history of breast cancer begin screening earlier than the general population. What role does differential diagnosis play in advanced practice nursing, and how can clinical algorithms assist in this process? Answer: differential diagnosis is a fundamental component of advanced practice nursing, allowing practitioners to systematically consider multiple possible conditions that could explain a patient's symptoms. Its role includes broadening diagnostic possibilities. A comprehensive differential diagnosis ensures that serious or less common conditions are not overlooked. Prioritizing conditions for further testing. By assessing the most likely diagnosis first, practitioners can order appropriate tests that yield the most relevant information. Enhancing patient safety. A thorough differential diagnosis reduces the risk of misdiagnosis and associated complications. Clinical algorithms. Algorithms provide a framework for generating differential diagnoses based on symptom patterns. For example, algorithms for abdominal pain can help clinicians systematically assess potential causes such as gastrointestinal, urological, or gynecological issues, ensuring a thorough evaluation. Explain the significance of understanding reference ranges and clinical significance in interpreting laboratory results. Answer: understanding reference ranges and clinical significance is vital for several reasons. Contextualization of results. Reference ranges provide a baseline for interpreting laboratory results. Values outside these ranges can indicate pathological conditions but must be assessed in the context of the individual patient. Clinical decision-making. Clinicians must determine whether abnormal results warrant further investigation or immediate intervention, as not all deviations from the reference range are clinically significant. Population-specific variability. Reference ranges may differ based on demographics, and clinicians must adjust interpretations accordingly. For example, the normal range for hemoglobin may vary for different populations, necessitating tailored assessments. Example: A complete blood count (CBC) showing a white blood cell count of 15,000 may indicate infection, but if the patient is immunocompromised, the clinical significance could be more urgent. Describe the ethical considerations surrounding informed consent in advanced practice nursing, particularly regarding diagnostic procedures. Answer: informed consent is a cornerstone of ethical practice in advanced nursing, involving several key considerations. Autonomy. Patients have the right to make informed decisions about their healthcare. Practitioners must ensure patients understand the nature, risks, benefits, and alternatives of proposed diagnostic procedures. Comprehensibility. Information provided to patients must be in a language and manner that is easily understood. This includes avoiding medical jargon and providing visual aids if necessary. Voluntariness. Consent must be given freely without coercion or undue pressure from healthcare providers. Patients should feel comfortable asking questions and voicing concerns. Capacity. Practitioners must assess whether patients have the mental capacity to understand the information and make informed decisions. Special considerations are needed for vulnerable populations, such as minors or those with cognitive impairments. Informed consent is not merely a formality but a fundamental ethical obligation that fosters trust in the clinician-patient relationship and upholds the principles of respect and justice in healthcare. Explain how health literacy affects patient outcomes. What strategies can advanced practice nurses implement to improve health literacy among patients? Answer: health literacy is defined as the ability of individuals to obtain, process, and understand basic health information and services needed to make informed health decisions. Low health literacy can lead to poor patient outcomes, including increased hospitalization rates, non-adherence to treatment plans, and decreased ability to manage chronic conditions. Strategies to improve health literacy. Simplification of information. Use plain language when communicating health information. This includes avoiding medical jargon and using visual aids where possible. Teach back method. After providing information, ask patients to explain what they have learned in their own words. This ensures understanding and retention. Culturally tailored materials. Develop educational materials that are culturally relevant and sensitive to the needs of diverse populations. Interactive education. Employ interactive methods such as group discussions or workshops that encourage patient participation and feedback. Relevant guidelines. The National Action Plan to Improve Health Literacy emphasizes the need for effective communication strategies to enhance patient understanding. The use of the Health Literacy Universal Precautions Toolkit can also help practitioners create a safe environment for patients to ask questions. What are the core principles of motivational interviewing, and how can they be applied in the context of chronic disease management? Answer: motivational interviewing is a patient-centered counseling approach aimed at eliciting behavior change by helping patients explore and resolve ambivalence. The core principles include: express empathy. Understanding the patient's perspective fosters a supportive environment. Develop discrepancy. Help patients recognize the gap between their current behavior and their goals, motivating them to change. Roll with resistance. Acknowledge and explore resistance without confrontation, allowing patients to voice their concerns. Support self-efficacy. Reinforce the patient's belief in their ability to change by highlighting past successes. Application in chronic disease management. In chronic disease management, MI can be utilized to assist patients in setting realistic goals for lifestyle changes. For example, when addressing diabetes management, a nurse can use MI techniques to facilitate discussions around dietary changes or medication adherence. Discuss the ethical implications of using telemedicine in patient care. What considerations should advanced practice nurses keep in mind? Answer: telemedicine offers numerous benefits, such as increased access to care and convenience. However, it also raises ethical concerns. Confidentiality and privacy. Advanced practice nurses must ensure that patient data is securely transmitted and stored, adhering to HIPAA regulations to protect patient privacy. Informed consent. Patients should be adequately informed about the limits of telemedicine, including the nature of virtual assessments versus in-person consultations. Quality of care. Nurses must evaluate whether telemedicine can provide the same level of care as traditional visits, particularly in complex cases requiring physical examination. Considerations. Maintain a high standard of care by utilizing appropriate technology and ensuring that patients are comfortable with the telemedicine platform. Regularly assess the effectiveness of telemedicine practices and make adjustments as necessary to enhance patient outcomes. Mrs. Garcia is a 65-year-old patient with multiple chronic conditions, including hypertension and type 2 diabetes. She frequently misses her appointments and expresses feelings of helplessness regarding her health management. As an advanced practice nurse, what strategies can you implement to empower Mrs. Garcia in her health management? Answer: to empower Mrs. Garcia, the following strategies can be implemented. Engage in shared decision making. Encourage Mrs. Garcia to participate in her treatment plan by discussing her preferences and concerns regarding medications and lifestyle changes. Implement chronic disease self-management programs. Introduce her to self-management education programs that focus on practical skills for daily living, such as monitoring blood glucose and blood pressure. Motivational interviewing. Utilize MI techniques to explore her feelings about her health conditions and help her identify personal goals. For instance, if she desires to lower her blood pressure, collaboratively set realistic steps to achieve this goal. Use of technology. If comfortable, introduce her to mobile health applications that track her health metrics, providing her with a sense of control and encouraging engagement. Relevant guidelines. The patient-centered medical home PC-Image model promotes shared decision-making and emphasizes the importance of patient engagement in health management, aligning with the principles of Mrs. Garcia's care. How can advanced practice nurses ensure culturally sensitive care in patient education? Discuss specific strategies. Answer: culturally sensitive care involves recognizing and respecting the diverse backgrounds of patients, which can significantly impact their health beliefs and practices. Strategies include cultural competence training, participate in ongoing education about various cultures and their health beliefs, customs, and values. Individualized education, tailor educational materials and methods to align with the patient's cultural context. For instance, when discussing dietary changes, consider traditional foods and how they can be modified for healthier options. Language accessibility. Ensure that educational materials are available in the patient's preferred language and use interpreters when necessary to facilitate clear communication. Build trusting relationships. Take time to understand patients' cultural backgrounds and create a welcoming environment that encourages open dialogue. Relevant guidelines. The Office of Minority Health provides resources and guidelines for culturally and linguistically appropriate services, course emphasizing the importance of cultural competence in healthcare delivery. What role do clinical decision support tools (ESDS) play in advanced nursing practice, and how can they enhance patient care? Answer: clinical decision support tools are computer-based systems designed to assist healthcare providers in making clinical decisions. Their roles include evidence-based recommendations. CDSTS provide evidence-based guidelines tailored to patient-specific factors, improving the quality of care. Alerts and reminders. These tools can generate alerts for potential drug interactions, allergies, and overdue screenings, enhancing patient safety. Data analysis. CDSTS can analyze patient data to identify trends and outcomes, aiding in personalized treatment plans, enhancing patient care. By integrating CDSTS into practice, advanced practice nurses can reduce errors, promote adherence to clinical guidelines, and ultimately improve patient outcomes. Relevant guidelines. The Institute of Medicine (IM) emphasizes the importance of using CDSTS to enhance patient safety and improve care quality in its report on the future of nursing. Discuss the advantages and challenges of implementing mobile health applications in patient care. Answer: advantages: increased access to care. Mobile health applications enable patients to access healthcare resources and communicate with providers anytime and anywhere. Patient engagement. These tools can enhance patient engagement by allowing users to track their health metrics and receive reminders for medication and appointments. Cost-effective care. By facilitating remote consultations, telemedicine can reduce transportation costs and time away from work for patients. Challenges. Technological barriers. Not all patients have access to smartphones or the internet, which can create disparities in care. Data security concerns. Ensuring the confidentiality and security of patient information is critical, as breaches can lead to loss of trust and legal ramifications. Quality of interaction. The absence of physical examination can limit the clinician's ability to assess certain conditions effectively. Explain how predictive analytics can transform patient care and nursing practice. What are the ethical considerations involved? Answer: predictive analytics involves analyzing data to forecast patient outcomes and inform clinical decision-making. Its transformative potential includes risk stratification. By identifying patients at high risk for adverse events, nurses can implement preventative measures to improve outcomes. Personalized treatment plans. Predictive models can assist in tailoring interventions based on individual patient data, enhancing the effectiveness of care. Resource allocation. Analyzing data trends helps healthcare organizations allocate resources efficiently, ensuring that care is delivered where it's most needed. Ethical considerations. Data privacy. Protecting patient data from unauthorized access is paramount, and compliance with regulations such as HIPAA is essential. Bias in algorithms. Care must be taken to ensure that predictive models do not reinforce existing health disparities, which can occur if the underlying data is biased. Informed consent. Patients should be informed about how their data will be used in predictive analytics and the potential risks involved. Relevant guidelines. The Health Insurance Portability and Accountability Act (HIPAA) sets strict regulations on data privacy and security, which must be followed in predictive analytics practices. What are the key components of effective chronic disease self-management programs, and how do they contribute to better patient outcomes? Answer. Effective chronic disease self-management program (EMPA) typically include the following components: education, providing patients with information about their conditions, treatment options, and the importance of lifestyle changes; skill development, teaching patients self-management skills including goal setting, problem solving, and decision-making strategies; peer support, facilitating group sessions where patients can share experiences and support each other, fostering a sense of community; personal action plans, encouraging patients to develop personalized action plans that outline specific goals and strategies for managing their conditions; contributions to patient outcomes. Improved patient knowledge leads to better self-management and adherence to treatment. Enhanced confidence in managing their conditions reduces the likelihood of complications and hospitalizations. Greater engagement in their own care promotes long-term behavioral changes that positively impact health. Relevant guidelines. The Centers for Disease Control and Prevention (CDC) advocates for the integration of self-management programs into chronic disease management strategies to enhance patient engagement and health outcomes. Describe a common ethical dilemma faced by advanced practice nurses and propose strategies for resolution. Answer. A common ethical dilemma involves balancing patient autonomy with the duty to provide appropriate care. For instance, a patient may refuse a recommended treatment that could significantly improve their health due to personal beliefs. Strategies for resolution. Open dialogue. Engage in respectful conversations with the patient to understand their perspective and reasoning behind their decision. Provide comprehensive information. Ensure that the patient has all necessary information regarding the risks and benefits of the treatment, allowing them to make an informed decision. Consult ethical guidelines. Refer to the American Nurses Association on a code of ethics, which emphasizes respect for patient autonomy while also highlighting the nurse's obligation to advocate for the best interest of the patient. Interdisciplinary collaboration. Involve other healthcare team members, including social workers or ethicists, to provide additional support and alternative solutions. A 62-year-old female patient with a history of diabetes and hypertension presents with increased fatigue and shortness of breath on exertion. Upon assessment, you find her blood pressure is 159 Hg and she has bilateral pedal edema. What diagnostic tests would you prioritize to manage her condition, and what are the underlying principles guiding these choices? Answer. The priority diagnostic tests should include echocardiogram to assess for heart failure and evaluate left ventricular function, as the patient's symptoms and history suggest possible heart failure due to her comorbidities; BNP, B-type natriuretic peptide level, to differentiate between cardiac and non-cardiac causes of dyspnea. Elevated levels indicate heart failure. Urinalysis, to assess for proteinuria, which can indicate diabetic nephropathy. Basic metabolic panel, to check kidney function and electrolyte levels, particularly potassium and sodium, which can be affected in heart failure. These tests align with evidence-based guidelines for managing patients with chronic diseases, emphasizing the importance of identifying exacerbations of underlying conditions like heart failure, especially in patients with multiple comorbidities. A patient presents to the emergency department with fever, tachycardia, and hypotension. What immediate interventions should be prioritized according to evidence-based guidelines for sepsis management? Answer. Immediate interventions for suspected sepsis include rapid administration of IV fluids. Administer at least the AAG of crystalloid fluids within the first hour. Broad-spectrum antibiotics. Start intravenous antibiotics as soon as possible, ideally within the first hour. Monitoring and supportive care. Continuous monitoring of vital signs, oxygen saturation, and urine output. Implement measures to support blood pressure if necessary, e.g. vasopressors if hypotension persists. Lactate measurement. obtain a lactate level to assess the severity of sepsis and the need for additional resuscitation. These interventions are guided by the Surviving Sepsis Campaign guidelines, which emphasize early recognition and treatment to improve outcomes in septic patients. Mr. Thompson, a 70-year-old male with terminal cancer, has expressed a desire to transition to palliative care. He is concerned about the implications for his pain management regimen. What ethical principles should guide the care team's conversation with Mr. Thompson about this transition? Answer: the ethical principles include autonomy. Respect Mr. Thompson's right to make informed decisions about his care, including his choice to transition to palliative care. Beneficence: ensure that the care provided maximizes benefits, including effective pain management while transitioning to palliative care. Non-maleficence: avoid harm by carefully managing the transition to ensure that pain control is maintained, avoiding unnecessary suffering. Justice: consider equitable access to palliative care resources and ensure Mr. Thompson receives comprehensive support, including access to pain management specialists. The conversation should emphasize that palliative care does not equate to abandoning curative treatments but focuses on improving quality of life through effective symptom management. In managing a patient with chronic obstructive pulmonary disease (COPD), how can a multidisciplinary approach enhance patient outcomes? Provide specific roles of team members involved. Answer: a multidisciplinary approach enhances outcomes through primary care provider, coordinates overall care and manages comorbidities. Respiratory therapist provides education on inhaler technique and manages pulmonary rehabilitation programs. Nutritionist offers dietary advice to manage weight and optimize nutrition, essential for overall health in COPD patients. Social worker assists with access to community resources and support systems for coping with chronic illness. Pharmacist reviews medications for appropriateness, monitors for interactions, and ensures optimal medication adherence. This collaborative model addresses the diverse needs of COPD patients, emphasizing holistic care and improving adherence to treatment plans. MS Rodriguez, a 45-year-old woman with chronic pain due to rheumatoid arthritis, presents with an exacerbation of her symptoms. She expresses frustration with her current pain management regimen, which includes opioids. What alternatives should you consider, and how would you communicate these options to MS Rodriguez effectively? Answer: alternatives to consider include non-opioid analgesics, such as NSAIDs or acetaminophen, which may be effective for pain control. Adjuvant medications, such as gabapentin or duloxetine, which can help with neuropathic pain. Physical therapy to enhance mobility and strengthen muscles around affected joints. Cognitive behavioral therapy (CBT) to address pain perception and develop coping strategies. Effective communication should involve active listening, acknowledge MS Rodriguez's concerns and frustrations, share decision-making, present the alternatives in a collaborative manner, allowing her to express her preferences and concerns. Education, provide clear information about the benefits and risks of each alternative, helping her make informed choices about her pain management plan. Describe the impact of social determinants of health on chronic disease management and provide examples of interventions that could mitigate these effects. Answer: social determinants such as socioeconomic status, education, access to healthcare, and environmental factors significantly impact chronic disease management. For example, socioeconomic status. Lower income can limit access to healthy food and healthcare services, exacerbating conditions like diabetes. Education. Limited health literacy may hinder patients' ability to manage their conditions effectively. Interventions to mitigate these effects include community health programs, offering education and resources to promote healthy eating and physical activity. Transportation services, providing access to healthcare appointments to ensure continuity of care for underserved populations. Policy advocacy, working to improve health policies that address disparities in access to care. These interventions are crucial for improving health outcomes in vulnerable populations and require collaborative efforts among healthcare providers, policymakers, and community organizations. What strategies can advanced practice nurses use to enhance patient education and empowerment in managing chronic conditions? Answer: strategies include motivational interviewing. This technique helps patients explore their ambivalence toward behavior change and promotes autonomy. Teach-back method, assessing patient understanding by asking them to explain back the information provided ensures clarity and comprehension. Personalized education materials, tailoring educational resources to the patient's literacy level and cultural background improves relevance and understanding. Support groups, encouraging participation in support groups provides social reinforcement and shared experiences, enhancing self-management skills. By employing these strategies, advanced practice nurses can foster patient engagement, leading to better self-management of chronic conditions. Explain the application of the Transtheoretical Model (TTM) in patient counseling for lifestyle modifications. What stages should be addressed, and how would you approach a patient in the contemplation stage? Answer: the TTM outlines 5 stages of change: pre-contemplation, unaware of the need for change; contemplation, acknowledges the problem but not ready to change; preparation, intends to take action soon; action, actively modifies behavior; maintenance, sustains new behavior over time. In counseling a patient in the contemplation stage, the approach should include empathy, acknowledge the patient's feelings and uncertainties; information sharing, provide information on the benefits of lifestyle changes, addressing potential barriers; goal setting, help the patient identify small, achievable goals to move toward the preparation stage; support, encourage them to explore their motivations for change and offer resources for support, such as counseling or community programs. 50-year-old male patient with chronic kidney disease presents with hyperkalemia, K level of 6.2 Meckel. What immediate interventions should be implemented, and what guidelines should you follow to manage this condition effectively? Answer: immediate interventions include cardiac monitoring to assess for arrhythmias associated with hyperkalemia; calcium gluconate or calcium chloride administered to stabilize cardiac membranes; insulin and dextrose. Administering insulin helps drive potassium back into cells. Dextrose prevents hypoglycemia. Sodium bicarbonate may also be used to promote cellular uptake of potassium, especially in metabolic acidosis. Base agonists, such as albuterol, can facilitate the same cellular shift. Guidelines from the Kidney Disease Improving Global Outcomes (KDIGO) recommend monitoring potassium levels, closely evaluating the underlying cause of hyperkalemia, and adjusting the patient's medication regimen accordingly to prevent future occurrences. Describe the role of advanced practice nurses in the management of patients with substance use disorders. How should the concept of harm reduction be integrated into treatment planning? Answer: advanced practice nurses play a crucial role in assessment and diagnosis, conducting comprehensive assessments to identify substance use disorders and comorbid conditions; treatment planning, developing individualized treatment plans that incorporate evidence-based interventions such as medication-assisted treatment (MAT) for opioid use disorders; counseling and support, providing counseling, education, and support to promote recovery and address underlying issues. Integrating harm reduction involves recognizing the stages of change, accepting that not all patients may be ready for abstinence, and providing support for safer use or reduced harm; offering resources, providing access to clean needles, safe consumption spaces, and overdose prevention education, e.g. naloxone distribution; empowering patients, encouraging patients to set achievable goals that prioritize safety and health, ultimately fostering trust and engagement in the treatment process.